Hello, oddlings, and welcome to another installment of Oddly Medical. I'm Sarah,
I'm Chrissy.
and today we are going to be talking about the practice of medicine, as it were, various medical discoveries, happenstances, things. Just stick with me; it'll be a good time.
How medical of us. I
Oh,
wonder where the odd
it's
is.
so oddly medical.
Oddly medical.
Ooh, I do have an update though. Before we get started, so you remember last week when we were talking about the radium girls, and there was the doctor who actually came up with the test, Dr. Martland, who came up with the test that allowed them to say yes, these girls are being poisoned,
Oh, yeah.
and the girls had his back. Did you know? And I didn't know this till I was looking at photos. He also was the doctor who proved that when boxers get punch drunk, they actually have developed encephalitis, so swelling in the brain.
Oh.
But nobody knew that. He's the one who actually figured this out, reported on it, and they started making changes to boxing because of him.
So he's a good dude to have around.
I know,
Yeah,
right?
keep him.
Yeah. Basically, he's gonna blow the lid off whatever.
Right?
Um, in podcast minutia, we are one step closer to the ever elusive T-shirts. Those of you who we've
Yes.
those of you who we've promised T-shirts, we are very very close to having those. If anybody is interested in T-shirts, we don't have a store up because we don't really know how much interest there is in that right now.
Yeah, not yet, but
But if you are interested, drop us a line. Let us know. Okay.
the cool thing about our shirts too is you can do them in pretty much any color that you want to. It doesn't have to be just white or just black. You do you, boo.
Yeah, just size and color, and we'll get you as soon as we can. But if you're interested, let us know. All right. Anything else?
Not that I can think of.
Okay. So let's jump into it. So today's going to be three different categories of medicalness. Uh,
Category one.
category is
Yas.
executive wellness. Um, category is ancient medicines. So the first group are things that have been known as natural remedies for thousands of years, but kind of their journey into mainstream life.
Okay.
All right. So the first one we're going to talk about is aspirin.
Yes. Good friend of mine.
Yes. So aspirin is actually derived from willow bark. There's evidence that it has been used since as far back as 4000 BCE as a painkiller and antipyretic, i.e., takes care of fever.
Oh. Thank you for explaining. Thank you.
By the Egyptians and Sumerians.
That's actually pretty cool.
Yeah.
That even back then. I wonder how many other things they gnawed on before they figured that out.
Oh, but wait.
But wait.
We'll get to
There's
that.
more.
So the Ebers Papyrus is an ancient Egyptian medical text that they found that refers to willow as an anti-inflammatory and or pain reliever for like non-specific aches and pains.
So we're talking like Advil, the one that takes down swelling and fixes your headache.
Aspirin does it too. Aspirin helps with swelling.
That's an NSAID? Sad?
NSAID.
Yeah.
He's learning.
Get my board.
Fucking bored. Later, it was used by the by Greek and Roman physicians. So Hippocrates, who we talked about on the podcast before, he gets a bonus for this. So he actually gave willow leaf tea to women during childbirth.
Does he have a board?
He pretty much is the father of Western medicine, so I'm pretty sure he has all the boards.
Whatever.
But he was actually medicating women during childbirth. He was giving a painkiller. Not many people did that for a very long time.
I speaking as a woman who has given birth, we appreciate you. Thank you.
The next part was interesting, and I had no idea. So aspirin, or the salicylic acid, which is the active ingredient in aspirin, is actually naturally present in many fruits and vegetables.
Oh.
It's more abundant if it's in higher concentrations if the fruit is not ripe.
Okay.
But it's believed that humans have eaten these since we've been cultivating things to help with pain, even though we weren't quite aware that that was a component of it.
Okay.
So I have a huge list, but the reason I'm reading this list will be clear in just a second. It really will.
It's all gonna make sense.
It's all gonna come together. So, apples, apricots, avocados, blackberries, blueberries, broccoli, cantaloupe, cauliflower, cherries, chili peppers, cucumbers, currants, dates. Yes, these are in alphabetical order.
Wait. Is it currant or is it currant?
Currants.
I thought it was currant.
Why are you trying to be bougie? Just let the currant be a currant, goddammit. What?
I don't even have a comeback.
Currant.
Currant.
Currant, they're très iconique. Ridiculous. Dates, dried herbs and spices, eggplants, figs, grapefruit, grapes, green peppers, guava, kiwi, licorice, mint,
Good Lord.
all types of nuts, paprika, peaches, plums, prunes, radishes, raspberries, spinach, strawberries, turmeric, wine, and zucchini. So the reason
I know wine definitely like makes me feel better. So
Well,
there's that.
That's a whole other
That
thing.
helps.
No, but so the reason I read off that huge list is because if you look at everything on that list, it's from all over the world. There are tropical fruits there. There are Middle Eastern crops that are cultivated there. Those are crops, avocados. These are crops from all over the world. So,
Like the currants.
like the currants. Currants.
The currants.
But on some level, people knew, and as long as we've been cultivating agriculture, we've cultivated things that are going to help us feel better and are nutritious.
Like the wine. Thank you.
Like the wine, yes.
Take one bottle and you just won't give a shit no more. Ta-da!
Jazz hands. But back to aspirin. So in 1763, Reverend Stone used solicitates as an antipyretic. So he's the first one to isolate pretty much the active ingredient and use it for fever.
Oh.
In 1897, Felix Hoffman synthesized aspirin for the Bayer Pharmaceutical Company.
Ah.
So the reason Hoffman did this is actually kind of cool. So his father had been taking the unmodified, the salicylic acid, but it was tearing his stomach apart.
Oh, yeah.
Aspirin's hard on your stomach anyway, but the original form is even harder.
Worse?
Yeah, he's even harder on your stomach. So he decided, I wonder if I can synthesize it to where it's a little bit easier on you. So when you buy aspirin, like off-brand aspirin, it's acetylsalic acid. That first part of it is just a little chemical add-on that actually helps it better delivery system without chewing up your GI tract as much as it can.
So if you don't buy name brand, are you getting chewed tummy?
No. They're all. Okay. That's just the generic name. Because all medicines we got to put like 400 names on them.
Yeah, I know. Thanks.
But aspirin, but it's acetylsalic acid.
Gotcha.
So anyway, just pointing that out.
I do take my 81 milligrams a night.
You better. So in 1899, Bayer names the product aspirin and markets it. Until this point, Bayer had actually been a dye manufacturing firm in Germany and decided to start a kind of go towards the pharmaceutical world.
Where's the flip on that?
You know what? I couldn't find that.
I'm confused.
Yes. But they had decided to go, it's still chemicals, dyes, pharmaceuticals, whatever.
People can still die. But just a different kind of dye.
My brain.
You're welcome.
But this is the first one they really went all in with, and it paid off.
So Bayer is the one that. So aspirin is actually their
brand name.
So kind of like how Tylenol is Tylenol's brand name for acetaminophen.
Correct.
But everybody's like, hey, you got a Tylenol?
Yeah, same thing. You got an Advil. It's actually ibuprofen, but
Gotcha. Okay.
So in 1950, aspirin won the Guinness World Record for most frequently sold painkiller.
Was Tylenol not around yet?
I don't know.
Oh.
In 1971, John Vane found that it blocked prostaglandins, that's a whole chemical thing and I won't get into. But this was important because it worked well as an antiplatelet, i.e. it had cardiovascular, it helped with cardiovascular stuff, the reason that you take the 81 milligram. Right. He actually won a Nobel Prize for this in 1982.
A lot of Nobel Prize winners lately.
Yeah.
Take it.
There's another one later on. In the 2000s, more research was done. They found that it is a good preventative for ischemic strokes, i.e., strokes that are caused by a clot,
Yeah.
and that it is a cancer preventative.
Really?
Specifically, it is a cancer preventative for colorectal cancer, which is interesting since aspirin is hard on your gut. And I know people with colorectal problems, including myself, that don't take aspirin for that reason. But hey, you know, I'm confused, but hey, whatever.
Okay.
In 2011, they found in 8 clinical trials that people who took aspirin daily for a mean of 4 years had a 44% reduced risk of dying from cancer as compared to those who took the placebo. I feel like there's something unethical in that.
I kind of feel bad for the placebo group. Like, oh.
Like, what?
If you don't know, you're like, Bob just died. Guess
Bob
he
just-
was in the placebo group.
I was like, is this ethical?
Ay.
It was also argued that aspirin changed medicine. So, up until this point, you go to the doctor and their analysis of you would start with, where does it hurt?
Yeah.
But now patients were able to get an effective over-the-counter pain relief. And so, where does it hurt was not as much of a specific diagnostic tool. I mean, we still do it, obviously, like, where does it hurt?
Yeah.
But,
where's your most pain? On a scale of
1
0 to 10.
I hate that scale.
10 being the worst pain.
I'm a 10. I'm just gonna just let me return this text. Bane of my existence. Anyway, so it forced physicians to have to look at more than just, oh, you have pain there? Well, that's the problem, kind of a thing.
That makes sense. That makes sense.
Yeah, so I thought that was an interesting thought process. All right, so the next drug we're going to talk about is cocaine.
What's that?
I have never heard of that before.
No, ever.
Ever. What is that?
As I drink my Diet Coca-Cola.
We're going to talk about that, actually.
Good.
Okay. So cocaine was derived from the coca plant. It's been used in South America for thousands of years by the indigenous peoples in the Amazon rainforest and the Andes Mountains.
That's how they were able to build them huts. All hopped up.
Yes, yes. So it appears on pottery as early as 5000 BCE. In 3000 BCE, it was thought by them as a gift from the gods and used in both embalming and trepanning as a local anesthetic. Trepanning is when,
Thank you.
Yes. So trepanning is the process of cutting a hole in somebody's skull. Yeah, so this was done, so chronic headaches, schizophrenia, anything where they thought, hey, let's just open this bad boy up and see if we can release the evil spirits or the pressure.
Yeah, well, you know.
But they used it to increase their rate of breathing and thus their oxygen intake, especially in the mountains. So they did studies on people.
Makes sense.
Yeah. So they did studies on people like around Machu Picchu, which is the big Incan.
I just like to say that.
Machu Picchu.
Machu Picchu.
Where they did, they looked at the bodies of people who lived up in the mountains and people who lived in the valley below.
Yeah.
And there were distinct differences. Mostly their heart and their lungs were larger if they lived on the
because they adapted to be up there,
be at that high altitude. If you go to Machu Picchu now, they will give you a drink that's made from coca leaves, and it actually helps with altitude sickness as well.
Really?
Yeah.
Is it like legal, like on our standards, on our terms?
No, absolutely not.
Oh, okay.
Absolutely not. Do not take a drug test 5 days after you drink that drink.
That sounds fantastic.
You will pop positive for cocaine.
And awful.
Absolutely not.
I'd probably freak out. What's happening, man?
My sister-in-law threw up on the Temple of the Sun, so...
Oh! There's that.
Sorry, Trish. It was so ingrained in their culture, it was actually used as a measurement of time and distance. So, a cocara is the time it takes to chew a wad of coca leaves and the distance covered in that time. So, about 45 minutes.
What? I just picture people like zapping up on coke and being like, look what I can do, and just like hauling ass down the streets. All I got.
It was also used in Inca cultural and religious ceremonies as well. So it was an integral part.
It was a thing.
Yeah, of their culture. But here Europeans come to fuck the day.
They're really good at that, I've noticed.
So during colonization, the Spanish soldiers made the indigenous peoples chew coca leaves pretty much continuously while they were working the silver mines to increase production and compliance. So if
Yeah, that sounds legit. Keep them hooked and be their source.
Well, and if you all of a sudden you've been chewing it, if you've been doing coke for a long time and then you like just stop, the low is gonna suck. So
withdrawals at its best.
Yeah. The Catholic Church believed it was undermining the spread of Christianity. So in 1551, the Catholic bishops tried to get the Peruvian government to ban it.
Oh, them Catholics always taking away the fun stuff.
And as much as they're not actually wrong. So it was so ingrained in their culture, and you're getting your high from a substance, not from God. So they're not wrong per se, but still.
Yeah, but still.
Because again, you can come over to our religion, or stick with your own religion that's got cocoa leaves and fun parties versus us.
Up, down, up, down, up, down.
Right. However, the Catholic Church withdrew its petition when a 10% tax was levied on coca, and the money was given to the church.
Oh,
for the spread of the religion.
It's cute how that happens.
In 1662, Abraham Crowley wrote a poem called A Legend of Coca, which was the first mention of cocaine in English literature.
Okay.
I don't know. I just put that in there because I thought it was funny.
That is fun.
In 1860, Albert Niemann isolated cocaine from cocoa leaves. He noticed that the powdery substance made his tongue numb.
There's another face.
Around this time, Angelo Mariani made a tonic of Bordeaux wine and coca leaves called Vin Mariani. Clearly, he was...
So that's the wine they were talking about. There it is.
No, not that one.
No.
It claimed to restore health and vitality. We saw this last week. We'll just, just mix crazy shit together, and it'll improve your health.
Sure.
Until you have a heart attack.
You just don't care after a bottle.
Or you have a heart attack.
There's that.
In 1878, cocaine was touted as a wonder drug to cure the morphine addiction that many American Civil War vets came home with.
We got you off of this, but now you're hooked on that.
Yeah. W.H. Bentley actually published these findings in the Therapeutic Gazette. So it was written in a medical paper. Because, yeah.
I can't say I'm surprised, actually.
Oh, I can't either. Carl Kohler experimented with cocaine as a surgical anesthetic for cataract surgery. So until this point, there was no anesthesia. The only offer they had for you was mesmerism, which is hypnosis, basically. Other than that, you're just white knuckling that shit.
Is that real, though, hypnosis?
Yeah.
Okay.
It's a controversial thought process, but yes, hypnosis is real. He didn't like to use ether or chloroform, which we'll talk about later in this episode, because it has a tendency to make patients vomit. But he noticed that after soaking the eye in a cocaine solution, the patient no longer flinched when the scalpel touched the eye. Mind you, they were doing this without anesthesia before this. I won't even get LASIK, I'm so freaked out.
No. Put some cocaine in it, you'll be fine.
It will numb it. It'll burn like a bitch, though, I bet. But it soon became marketed as an anesthetic, but quickly waned as patients began dying from accidental overdoses during surgery.
Cute.
So, this brings us to William S. Halsted. So, he was a New York City Bellevue surgeon who experimented with it in the 1880s. He was apparently like a wonder surgeon. Very, very talented. I don't know if you ever watched the show The Nick.
No.
I think it was on Showtime.
Girl, I can't afford Showtime.
I don't know. Anyway, it was a fantastic show. It was only on for like 2 or 3 seasons.
Okay.
But Clive Owen's character, like reading this guy's life, I am 99.9% sure this is who his character was based on.
Who he was based on, yeah.
Anyway, so he famously removed his mother's gallbladder on her kitchen table.
Like you do. Yeah.
He started experimenting with the cocaine and found that it was really good for nerve blocks. So they'll go in, if you're going to have specific surgeries, they'll go in and they'll inject, now they do it with lidocaine, today they'll inject it directly into a nerve, and it deadens that nerve from the injection site down. We use it all the time for,
but it's not permanent.
No.
Yeah.
But we use it all the time for like knee surgeries and back surgeries and things like that, so that the pain comes back gradually after you do that surgery. Nerve blocks are very cool. So he was using cocaine for this, which again had the same effect. Unfortunately, he started injecting it to study the effects. Then he started using it to fight fatigue, and then he became addicted.
Yep, that's how that goes.
Like you do.
Like you do.
But it's pretty sad because he actually was a surgical pioneer. He made huge advances in blood transfusions, and in sterile technique. But his erratic behavior due to cocaine and then morphine addiction basically basically killed his career.
And him?
So he apparently lived old age. It's interesting. So in early surgery, you weren't judged on how many people died. You were just judged on how fast you could do shit.
Okay.
Yeah. But he, later on, after he kicked his habits and blah, 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 he pioneered the more meticulous sort of sterile techniques. Because before then they didn't even use gloves. Like, he started using gloves.
I mean, he did remove his mother's gallbladder on a kitchen table. So there's that.
It's fine. They all got the same cooties. It's fine. But, and took his time with surgery, which they made fun of him at first. But his patient mortality was so low that they were like, there might be something to this.
Looks like he's onto something.
Right. So, and I was reading, and there's evidence that he was actually like a closet homosexual, and there's all of that goes with that time period and homosexuality and things like that. I'm going to read a biography on him because I found 2 of them I desperately
Nice.
But he sounds just super interesting. Anyway, I'll let y'all know more about that as I read. Anyway, back. So the next person we're going to talk about is Freud. Sigmund Freud, who's the father.
Sigmund Freud?
Yes. Who is the father of psychoanalysis.
That's why I know him.
Yeah. So in 1884, he wrote a paper called Ubercoca. I love that you were drinking.
I almost just spit out my Diet Coca-Cola all over her notebook. Or it almost came out of my nose, which is a good place for Coke, so I hear.
So I've been told. But yes, paper called Ubercoca. Where he described it as a song of praise to this magical substance.
He was high.
He recommended it as a psychiatric treatment. He used it for his own depression, as he said it gave a feeling of, quote, exhilaration and lasting euphoria, which is in no way differs from the normal euphoria of a healthy person. You perceive an increase in self-control and possess more vitality and capacity for work. In other words, you are simply more normal, and it is soon hard to believe that you are under the influence of a drug.
Okay. So...
yeah, you're more productive. After this, Freud struggled with a pretty hefty cocaine addiction for about 12 more years.
But it made him euphoric.
Right.
He was so happy.
Right. And yes, and I'm sure that's true, but when you come down, it's even worse. And as somebody who used to self-medicate, trust me, the after is worse.
Oh, no.
But cocaine made its way into the popular world as well.
Obviously.
Sherlock Holmes in the 1887 book A Study in Scarlet, which is the first Sherlock Holmes novel.
Okay.
He injected it to wind down. Now, the character of Sherlock Holmes is bipolar as hell, and he's...
Oh, really?
Oh, God. And he does drugs throughout the series, and he's constantly injecting stuff. So, just saying, like...
Sounds like a fun guy.
Yep. John Stith Pemberton founded Coca-Cola in 1886.
Thank you.
With a cocaine and sugar syrup concoction. It was served at soda fountains at first and then became bottled. But the cocaine was removed in 1903. And the things I read, it's very controversial why this was removed. Some say it was new guidelines. Some say that it was because when it became bottled, you didn't have to go into a soda fountain to get it. More African American people started to buy it, and he didn't like that, and then it led to addiction. Well, there's this whole rabbit hole you can go down of conspiracy theory with Coca-Cola. I was like, ooh, that's not something I need to fall down this episode long enough.
No.
So, but anyway, cocaine was removed in 1903. In 1905, snorting cocaine became popular in the United States. It was carried around in these little ornate, like, ring boxes.
Yeah.
And they called it cocaine snuffing because they were originally snuff boxes. Both are stimulants. In 1910, they started to notice that nasal damage was being reported in American literature because it is such a powerful vasoconstrictor, which is one of the reasons we still use it today in medicine, that people's noses weren't getting enough blood and parts of it were becoming necrotic and falling off.
Why do we keep having falling off noses lately?
I don't know, man. People are just coming for people's noses.
Oh my God.
However, it was still sold over the counter at Harrods in London.
Well, of course.
Of course it was. In 1914, it became illegal in America, but was still given to British troops in the form of a, quote, forced march tablet. You gonna be awake for this.
Literally.
But in 1916, a Defense Against the Rome Act made it illegal for morphine and cocaine to be sold to British armed forces. Today, we still use cocaine in medicine. I was working at an ER, and one of the doctors asked me to go get him cocaine. I was very puzzled. And I was like, what? But we have it in our medicine Pyxis. We still use it today. If you have a nosebleed that you cannot stop on somebody, liquid cocaine will stop that shit in its tracks.
Jesus. I actually read something yesterday because I have this smell that is just stuck in my senses right now. Mm-hmm. And I have parsomia from COVID a while back.
Right.
So, but I was reading, like, if there was something that I could do, like sniff coffee to get the smell out. And it actually was talking about treatments for it. One of the treatments was cocaine, like at a doctor. Like there's like postal cocaine treatment. And I'm like, nope, I'll smell the smell.
But the American Academy of Otolaryngology, which is like head and neck surgery, considers it a valuable drug for its combination anesthetic and vasoconstricting properties. So there are surgeries they do to the mouth, the throat, and the nose where specifically cocaine is their preferred anesthetic because of these properties.
Okay.
There are 2 commercially prepared nasal sprays with cocaine in them. Sorry, I couldn't even say it without laughing. Numbrino. Numbrino and Goprelto.
That one's not as fun. Go with Numbrino.
Numbrino.
Wait, do they sell this over the counter?
No. You have to go to a doctor.
Oh, okay.
Because it's a cocaine hydrochloride spray.
Oh my God. Can somebody, like, get high off of it?
I imagine it's like Afrin on steroids.
No, it's Afrin on Coke.
Right? You just stick with your Afrin.
Right.
All right. Now on to our next section. I termed this section Happy Accidents. So the first happy accident is penicillin. So penicillin was discovered by Alexander Fleming in 1928. He had just gotten back from a vacation and was cleaning out some old Petri dishes and noticed that on one of them there was a big old blob of mold and nothing was growing around it. None of the bacteria was growing around it.
Yeah.
So he thought, so he called it mold juice, which is gross.
Loving.
But he was never really able to isolate enough of it for kind of wider distribution.
Okay.
So in 1939, a team at Oxford began working to isolate it. But World War II made this somewhat difficult to get supplies. So at first they grew it in bathtubs and bedpans.
Oh, good God.
Milk churns and food tins. It's mold.
Bathtubs.
They eventually did invent an apparatus to, like, this medium bath thing. Anyway, that would grow it. And it was this huge concoction.
So it had, like, its own area of growth.
Own area.
Okay. Not just randomly walk into a room like, oh, shit, not that one.
Yeah. And they hired what became termed as penicillin girls to...
Oh, God, it's not like the radium
No,
girls.
no, 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 no.
Okay.
In fact, these were probably like the least sick people ever. They were just around antibiotics all day. And they were paid £2 a week to mine and farm the penicillin out of this apparatus.
Oh.
Yeah. So production really ramped up after it began being used as an antibiotic for the soldiers.
Oh, okay.
Because
like
again,
you said,
war. Yes, war. Nothing advances technology like war.
Yep.
Because we got to keep them alive so they can go die out on that battlefield.
Give them some cocaine and some penicillin.
Pat them on the ass and send them back
There
in.
you go.
But that's all I'm going to talk about penicillin. But anyway, the next one we're going to talk about is the first pacemaker.
All I know is you told me that's pretty funny. So
in 1956, an engineer named Wilson Greatbatch was trying to build a device to record heartbeats, so like a monitor. Yeah. But he installed the wrong type of resistor into his prototype. So instead of recording heartbeats, it was giving out electrical impulses.
Oh,
But
yeah.
He refined it and
happy accident.
Yep, and patented it in 1960, and that was the first pacemaker. The last one on my happy accidents list is Viagra or sildenafil.
I can't.
I was hoping you'd get that. So, Viagra was originally developed to treat hypertension, but it wasn't going well.
It wasn't lowering.
It wasn't going well. It really, pun completely intended, it really, people with chronic hypertension, it wasn't making a dent. So as a last ditch effort, they decided to take the grubbiest group they could find. So they tested on a group of miners. Like coal miner kind of.
Oh, I thought you meant minor like children.
No.
Oh, okay.
But that's a whole other thing. But yeah, so they tried it on a group of miners. And so they're sitting down with these dudes because they know these dudes will be honest because they don't care.
They don't give a no.
Yeah, they don't give a shit. And they're like, do you notice any other side effects? And one dude was like, well, I have more erections at night. And he kind of giggled and they looked, and they looked around the room and all the other guys are like, yeah.
That's true. Facts.
Yeah,
facts.
And they were like, so they decided to run another set of tests where they gave Viagra to people and they had them watch porn wearing, and I shit you not, this is true.
Do it.
Wearing a Regiscan.
What?
Or Rigiscan to test erections. Apparently it's something you put on your junk and it tests the strength of your erection. Why is this a thing? Why does this exist? I was like, okay. Sure.
When you want to be the top of your class. What if he had a little thingy? Did it register correctly?
I mean, I don't know.
So there's no pictures of this?
Oh, I'll find a picture.
Of this apparatus?
Girl, I'm going to find a picture. You know I'm going to find a picture.
Oh my God.
This was a hard episode to put together, so I haven't done my pictures yet, but I will find this.
Oh.
But yes.
This is worse
I get
than
some weird, like,
scrotum thing.
Road to Wellville contraption in my head. But anyway, if you've never seen that movie, it's pretty funny.
I haven't.
Oh, it's so good. Anyway.
But kind of want to now.
But let's back up, shall we? Erectile dysfunction has apparently been a thing since there have been people. So there's evidence of erectile dysfunction on Egyptian tomb walls, on the walls of Pompeii.
What is it, just a limp?
I don't know. I don't read these things.
Like,
so men in ancient Roman Greece wore talismans of rooster and goat genitalia. They believed that these served as an aphrodisiac. I'm not sure to whom. Not to the woman. Not that we're really involved in this.
Is that how they got the name cock?
I don't know.
Just saying.
Yeah, I'm going to put you on that one.
Googling later.
And promote sexual function. There are Chinese remedies that actually still exist today that involved ground rhinoceros horn. Some remedies in the way back involved ingesting wolf and rabbit penis as well as hawk and eagle semen.
How are they getting this semen?
Well, you can. I mean, hawking and falconry was a whole thing. I imagine you just put the hood on and say, "Think happy thoughts." I don't know.
I have questions. I don't want to know the answer to them though.
Dude,
How? No.
notice it is not on my research. I did not.
Listen, I need you to get detailed.
I will find out, dear listeners, and I will update you next week.
Thank you.
So by the end of the 18th century, Dr. Samuel Solomon created his cordial balm of Gilead. Impotence at this time was thought to come from too much masturbation and the voluntary loss of semen.
Oh, I get it. The voluntary. I get it. Okay, moving on.
So the balm was devised to prevent the desire to masturbate, therefore maintaining your semen reserves. Oh god, why would anybody put this on themselves? But okay. So it was made of cardamom, fine, brandy, probably stung, and cantharides. So
which is
these substances are secreted by blister beetles. Yeah. They're poisonous in larger doses. They're called blister beetles for a reason, so they can cause chemical burns and blisters when applied topically. So you were supposed to apply this balm to your balls
ball balm
in a cold water bath. So you're like blistering your penis in cold water and like
that'll turn off anybody's want to
no
to snoodle their noodle on their own.
Snoodle their noodle. Dumb. So there's that. Although I do find it interesting that in order to keep men from masturbating, you have to go so far as to chemically burn their wiener to keep them from touching it.
Who's shocked? I'm not.
No, there's no hands up here.
Oh my god.
So in the 19th century, they became aware of the link between low testosterone levels and impotence. So people started trying to inject testosterone from dog and guinea pig testicles into people. Oh, that's not the worst thing that's about to happen in this sentence.
Oh.
So Dr. Serge Voronov was a Russian surgeon who began performing ape-to-human testicle transplants.
No!
Yes, ma'am.
No.
Yes, ma'am. If you have 8 balls, you will be fine.
So
Yes?
They weren't taking away, they were just adding?
No, they were taking off your human testicles and grafting 8 testicles onto people. I found the way to shut Chrissy up.
Oh my god.
Now, this didn't work.
I was gonna say, did it?
No!
Like, could that even work?
No! It didn't work. However, it did lead to
a decrease in population because no woman wants to see that?
Or because they were probably impotent and scarred at that point. They were at least
they have monkey babies?
No, they cannot have monkey babies.
Okay.
They do not work. It did, however, lead to the synthesis of testosterone by Adolf Butanandi? I don't know. I can't say.
We're just going to say thank you, doctor.
Adolphe B. In 1935, and for which he also won a Nobel Prize in 1939.
As a thank you from the apes as well, I'm sure. Oh my god.
But back to Viagra. So the trials concluded in 1996, and it was on the market by 1998, which, if you know anything about drug stuff, is fucking fast.
Yeah. Well, isn't it like the more funding they have, the faster it goes? Because like the COVID stuff came out super fast, and everybody's like, whoa, whoa, whoa.
It's not so much funding. So the COVID vaccine came out so quickly because the technology was already there. With COVID vaccine synthesis and the particular type of vaccine that they used for COVID, we already knew how to do that. So being able to mass produce it quickly, it wasn't like figuring out vaccines like, let's blow these shavings in your face and then go from there. It wasn't like old-time vaccines. Because remember, we synthesize a new flu vaccine every single year. So every year around right before flu season, they kind of do feelers. They check kind of what viruses are in the mix. And then they make a bunch of the flu vaccine and they give it to you. So we've been making vaccines quickly. We make them every year because the flu vaccine is different every single year.
See, I didn't know that.
Yeah. Like I said, they take samples of the population and people who are getting sick early and go, okay, this is how this is mutated this year.
Yeah.
This is how this virus is trying to kill us this year.
You little bastard. Can it stop?
No. And so they, in like a couple months, they synthesize all the flu vaccine that we get every year. So the technology was there for the COVID virus. And that's why it happened so quickly. It's just that people don't think about the flu vaccine changing every year.
Well, as common folk, we don't know that it changes every year.
So people were like, it came out so quickly. And I'm like, all your vaccines come out quickly now. You just don't know it.
Yeah.
So anyway, I digress. Anyway, but at this time, usually for when they like start trials to when they market a drug, like it's usually like a 10-year thing.
Yeah.
Nope.
Nope.
2 years, because nothing motivates men like their wiener. But it is credited with changing the conversation about sex and how medications are marketed. So this was the first medication that had TV ads. Bob Dole endorsed it on TV.
I don't remember Bob Dole doing it.
Yes.
But I do remember.
Bob Dole endorsed it on TV. It was a whole thing.
Oh my God.
If there had been memes, it would have been everywhere.
Oh, yeah.
So there's no segue to this next part of this. I just thought this anecdote was amazing. So it was used by the CIA, actually, in Afghanistan to influence tribal elders. So... Girl. So there was a 60-year-old chieftain that was pretty wary of Americans. Like, he wasn't against or for. He was just kind of like, I don't know about you guys. But he had extensive knowledge of the region they were trying to go into, and his village controlled key kind of passages through certain areas.
Yeah.
So clearly they needed his cooperation.
Yeah.
So they started talking to him. They talked to his wives and to kind of assess the situation. They assessed his overall health.
Go with the wives.
And they were like, here, try this. 4 days later, he gave them access to everything.
You can have all of it.
All of it. So
here's some sheep. Here's some cattle.
What do you want?
Here's some guides. Yeah.
Yeah, everything. So there was really no segue into that. I just thought it was funny.
That is awesome.
In 2007, it was Viagra was associated with. They have a thing called an Ig Nobel Prize. So it's kind of like a Darwin Award kind of a thing.
Gotcha.
So it is awarded for the year's most useless research. So in 2007,
is this kind of the Raspberry Award?
Kind of a thing.
Yeah.
So there were 3 Argentinian scientists that found that Viagra helped hamsters recover faster from jet lag.
Why are they testing this?
However, Viagra still is used for pulmonary hypertension in small doses. So pulmonary hypertension is you got the right side of the heart, and from the right side of your heart, your blood goes into your lungs, gets oxygenated, comes to the left side of your heart, and then from the left side of your heart gets squished out to the rest of your body.
Yeah.
So the pulmonary artery, which is the only deoxygenated artery, it's the whole thing. Anyway, so if those vessels are damaged, constricted, anything like that, you can't really oxygenate your blood well at all.
Which is bad.
Right. So Viagra specifically dilates your pulmonary arteries well. So you can actually oxygenate your blood. Because if they stay kind of constricted, your right side of your heart gets bigger, you get heart failure. It's a whole long thing.
It's a whole thing. It's ugly. It's messy.
Yeah. So anyway, it's still used for that. I found that out the hard way when I was in the ER, and I was like, why am I giving Viagra in the ER in the first place, but also to a woman? And they were like, one of the doctors just looked at me and goes, apparently I need to explain this stuff to you. I was like, clearly.
Yes, please. Can we have the talk?
However, there were sometimes they would order it wrong, and I was like, you ordered the Viagra for PRN for sex. We don't do that in this ER.
Oh, no, not here.
Not today, Satan.
Oh my God. No, never mind.
Anyway.
Not surprised.
So now we are on to our last section, which I termed "Wanna Get High."
Wanna get high.
But basically, this is going to be a quick and dirty, like, history of anesthesiology, real quick, but still fun. So we're going to talk about ether and nitrous oxide for a second.
That's laughing gas, right?
It is. That's what they called it.
Ah.
So ether was first synthesized in 1540 by Valerius Cordus. He called it sweet oil of vitriol. Some say, though, that it had been used in some form or another since either the 7th or the 9th century. That's a whole rabbit hole that I didn't want to deal with. Nitrous oxide is actually present in the atmosphere, but it was discovered by a man named Priestley in 1772 who called it laughing gas.
Yeah.
So both nitrous and ether were used exclusively as party drugs until the mid 19th century.
Ooh, ooh.
So people would pay for a balloon of nitrous, and then once they were high, the people who sold them the nitrous would then sell tickets to other people so they could watch the person be high.
Hell yeah! But you don't get high that long off nitrous. It's like a whippet, right? So I've heard. Isn't that what a whippet is?
Whippet's gonna last like 20 minutes, though.
Dude, I got robbed.
You gotta pick the right whipped cream cans. Anyway, so in the early 1800s, ether was often drunk instead of alcohol when alcohol was scarce or something was banned or whatever. They just went and drank ether.
But it caused a lot of problems, didn't it?
Oh, yeah, we'll get there. In 1844, a dentist named Horace Wells noticed that people who hurt themselves while partying, they didn't feel it until the gas wore off, and then they were like, "Why the hell why am I bleeding?"
My foot is missing.
So on December 11th of that year, he bought some nitrous.
Yeah.
Inhaled said gas, and then had his partner pull one of his teeth. This time doctors tried all their shit on themselves. After which he said, "It's the greatest discovery I ever made. I didn't feel so much as the prick of a pen." So Wells was like, "I need to share this with everyone." So he went to Massachusetts General and tried to demonstrate it, but the dude running the apparatus kind of did it wrong, and so the patient was never anesthetized and started screaming as soon as they went to pull the tube.
No.
And it was a debacle. It was horrible. He was booed out of
He
was booed off the stage.
Oh my God.
His career never really recovered, and we'll come back to this poor gentleman in a second. But in 1846, on October... There's a reason I know this date. So Friday, October 16th of 1846, William Thomas Green Morton made the first successful demonstration of inhaled anesthesia. He was using ether, but they were both using like nitrous, ether, whatever.
Yeah.
And this is actually still known as Ether Day. So this is apparently the birth of anesthesiology is Ether Day. So he did not discover this, but he did popularize it.
Gotcha.
And he had actually been Wells' student.
Ooh.
In 1842, he had been Wells' student. When he succeeded, Wells went into a horrible depression. So he started experimenting with chloroform. Got addicted to chloroform.
You can get addicted to chloroform?
Yeah. Anything that makes you high, you can get addicted to.
I thought it just knocked your ass out.
No, not in smaller doses.
Oh.
We'll get to that. Chloroform's next. He was later arrested for throwing acid on prostitutes while he was high.
Like you do.
And was jailed and killed himself in jail. So it's pretty sad, actually.
Tragic.
I know. The use of ether as an inhaled anesthetic could actually be attributed to a Dr. Crawford Long, who possibly started using ether for this use in about 1842. Remember, Ether Day is 1846.
Yeah.
So 4 years. But he didn't publish until 1848, 1849, depending on your source, because he wanted to collect enough data to make sure it was safe. Morton didn't give a shit.
We appreciate that.
We appreciate you, Dr. Long. Morton didn't give a shit. He saw the opportunity and went.
Yeah, he did.
Chloroform was another early anesthetic. It was also another party drug, but it became popular as an anesthetic during the Civil War because it worked faster than either ether or nitrous, and it was non-flammable because ether is super flammable.
So basically, like, if they ever just wanted to find something new that made you feel good, like, what are the kids using these days?
That's kind of where we are with that. It worked faster and it was non-flammable. And since they were doing a lot of field amputations, gunpowder and ether were not exactly a good combination.
Oh, really?
Ether.
It's gas, right? Well,
no,
was liquid.
It's liquid, but then they have these. I'll put the masks on the thing, but they have these masks with like a rag, and you drip the liquid on it, and it vaporizes, and you like inhale the vapors.
Okay. It's kind of like chloroform. You pour it on a rag, stick it over their face, and boop.
Yeah, except for it's kind of tinted up when you use it for anesthesia, so it has time to go from the liquid to the vapor, and then you inhale the vapor. Ether was not used very long in operating theaters because they had gas lights. And you're using a very flammable liquid.
Oh.
And shit would catch fire.
Oh, that's bad.
Right. So, chloroform. Better when there's explosions.
Got it.
It was first prepared by chemist Dr. Samuel Guthrie in 1831, who combined whiskey and chlorinated lime in an attempt to make a cheap pesticide.
Hell yeah!
It just kind of went from there. Clearly, he was indoors when he was trying that.
Oh,
I was like, I got this shit down.
Write that down.
In 1847, it was used by Scottish physician Sir James Young Simpson as an anesthetic. So, literally, 1846 for ether, 1847 for chloroform. So, all these were happening like right at the
really
same
fast.
time. Yeah, all at the same time. Chloroform, however, requires more skill than the other two because the respiratory depression is much more like your chances of dying are much more with chloroform.
Oh.
Because it suppresses your respiratory system. Didn't stop people. It was given to Queen Victoria during the birth of her 8th child, Prince Leopold.
By that point, you can't even feel it. It's just falling out. What's the point?
You know what? I don't know. But it was found to be carcinogenic in the early 20th century and is rarely used today except for like aerosol propellants and refrigerants. And I always wondered why aerosol cans smelled sweet. Now I know.
Oh, there it is.
But most anesthesia today is a combination of various inhaled agents and medications such as like painkillers, propofol, Versed, certain paralytics. So it's kind of a dance now. However, there is one drug that could possibly make it a one-stop shop. And this is xenon. So xenon was discovered by the Scottish chemist William Ramsay and English chemist Morris Travers in July of 1898. So they had already extracted argon, neon, and krypton from liquid air.
Krypton?
Yes. It's a noble gas. Krypton.
I didn't know that one.
They found that when they isolated it, it emitted a really beautiful blue glow. So they named it Xenos, from the Greek word meaning stranger.
Oh, okay.
It is found in 1 part per 20 million in the atmosphere, though it has been found in higher concentrations in meteorites, which makes people speculate about kind of early primordial soup universe, like what was the makeup of it, since meteorites have so much more in it. And then some scientists, so theoretically we should have more xenon in our atmosphere, but we don't. So scientists theorize that all our xenon is in the core of the Earth, bound to nickel and iron. Obviously, we haven't been able to test that.
Oh, okay.
But that's a thought. Anyway, theoretical science. Mostly xenon is used for lights because it illuminates better than any conventional light. So the blue headlights that you see,
hate those.
Those are xenon.
Hate those.
It's also an engine propellant for satellites, and that's gonna be important later.
Okay.
So, but in the 1940s, they noticed that it had a narcotic effect on mice and rabbits. Why we know this, I don't know. So it has been used in anesthesia for about 50 years. It's the heaviest and least soluble of the noble gases. And what I mean by soluble is when you do an inhaled anesthetic, a certain amount of it gets absolved into like your absolved, really absorbed by your fatty tissues and certain organs and whatnot. And then you have to like get it out of your system.
Oh, okay. Get depleted.
Right. So it's the least soluble of any of the gases. And it works by itself, like as a single atom element thing. There's no other element that works like this.
Oh.
Because most things are in a compound. They are.
Yeah.
Yeah. Nope.
Nope, just on its own.
Just on its own does its thing.
Nice.
It does not get have any effect on your heart. So a lot of people, we do a lot of heart caths on people who need cardiac clearance before they have anesthesia.
Yeah.
Because most anesthesia causes heart things.
Yeah.
This does not. Other beautiful things about xenon is its rapid induction, i.e., you go to sleep fast. And and you come out of it fast. It's sufficient analgesia and hypnotic properties, so pain relief and not remembering properties.
Yeah.
Undisturbed ventilation, so it doesn't have the respiratory depression. Nice. It doesn't mess with your pulmonary function, and no malignant hyperthermia. Malignant hyperthermia is a condition, it's a genetic condition usually, where when you get anesthesia, like your body temp goes through the roof, you have seizures, like it's a whole thing. So the biggest drawback with it as an anesthetic is that it increases cerebral blood flow. Ooh. And is retained in the bowels. So if you have somebody who's having surgery and has increased intracranial pressure for any reason,
yeah,
or has a bowel obstruction, which there's a lot of surgeries for bowel obstructions,
yeah,
you wouldn't want to use this. But really, those are the drawbacks as far as chemically.
So like only 2.
Yeah,
that's not bad.
The biggest reason why it's not mainstream, however, is that it is hella expensive.
Oh, yeah. No, my insurance would be like, no, just hit her over the head with a rock. Thanks.
It's $10 per liter.
And how many liters is it normal for like an hour put out? Ooh.
Yeah.
Ooh.
So it's $10 per liter just to extract it. And that's not packaging and shipping and blah, 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 blah. Like that is how much money it takes from the beginning to extract it from the air. And it's a very laborious process.
Oh, damn.
Right. They have tried inventing rebreathing apparatuses that make it so that you're not wasting any, like, through the mask.
Oh, yeah.
But we're not there yet. They were going to start trying to test it for hyperbaric medicine. So when you get the bends, after you come up, if you come up too fast, you have the nitrogen buildup, they put you in a hyperbaric chamber.
I've heard of it, yeah.
Decompression chamber.
Yeah.
You've also heard it called like that. But we weren't able to do that because the Russians had actually stockpiled most of the xenon because for the ballistic missiles and satellites and things like that, because it's a satellite propellant. And that's mostly what it's used for. However, people will not be deterred when there's a good high to be had.
Absolutely not.
So, it is at this point used widely in the Czech Republic and Russia, but also I found stuff in Switzerland. I found stuff in Serbia. I found clinics all over, like Eastern Europe, all that kind of stuff, where they have these xenon clinics where they say that it treats anything from,
here it goes again,
cancer pain to schizophrenia. So it is marketed to treat a wide range of problems such as chronic pain, stress, depression, anxiety, addiction, concentration issues, cancer, immunotherapy, blah, 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 blah.
These
blah, blah.
cure-alls are abundant.
Yes. We've seen this pattern before.
Yeah.
Right. Some people use it as a spiritual meditation technique.
Okay.
I watched this. So the same guy, you remember when we did the zombie episode and I talked about the wacky, like, skinny white guy who went down to Haiti?
Yes.
Okay. So
same guy?
Same dude, right?
Oh, I like this guy.
On this YouTube video, goes to the Czech Republic and goes to this whack ass, like, xenon clinic. And I was like, oh, what am I watching? It is, thank you, Steven. That was the biggest train wreck. I was like, I can't, what am I watching?
What's happening?
Like, at one point, these two guys come in, they're breatharians, which means that they only eat breath, isn't it? Yeah, so they don't eat, they just drink. They don't eat anything. They live off breath. They live off the air or whatever. Yeah, well, Homestar started vomiting in the mask, almost aspirated. Oh. The one chick who runs the clinic has the mask on and is singing opera. Like, it is the most wackadoo thing.
Kinda want to watch this.
Oh, man, it's a thing. It's a vibe. But it creates this sense of euphoria. Like, this one lady in that clinic had brought her children to do it as well.
No.
Because she said that it was a spiritual experience and she saw God and she wanted her kids to have that. And the little girl was all like, I saw unicorns and angels and blah, blah, blah. And I was like, I have a question.
I have questions. There's CPS in this country.
No.
I know some checks. There's some crazy people.
But yeah, it's kind of nuts. And it's not really regulated closely because they're getting these machines and then just setting them up in these places and then doing this thing. Is it relatively safe? Yes. Also, can you die? Yes. But to round out our anesthesia thing, I actually found that Massachusetts General, where we did the birth of this is where the ether trial
that's right, yeah.
So Massachusetts General right now is recruiting for a study on xenon to test its effects on major depressive disorders and bipolar disorders. They actually have a whole criteria you can apply to be part of this study.
Oh my god. Oh my god. Do they pay to be a part of this study?
Usually. Anyway, so that is that. Stephen, I hope I did you proud. This is a really weird episode to put together, and I'm sorry if it seemed all over the place.
It was interesting. It was different. It was interestingly different, and I liked it. It's very on brand for us.
It's very on brand for us. It was just an odd, and I'm sorry I didn't do the methyl blue because I couldn't figure out how to fit that in there, dude. I'll find it later. But
well, what I loved was when Sarah had mentioned what the parameters of this one were going to include. I was like, hey, we talked about cocaine still being used in the ER our first night when we were talking about Oddly Medical, when we were birthing this little beauty for
at Olive Garden, where people thought I was Matt, and people thought that you were cheating on Matt with me.
Yeah, no, they didn't think you were Matt. They just, my boss's best friend and neighbor who can't see very well thought that I was, at Olive Garden with somebody else, and I was having an affair. So.
Yeah, those of you who don't know what I look like, my hair is very short, and I don't
wear
makeup. I look well, but I got makeup on those pictures. I was in a ball cap and a hoodie, no makeup.
I'm
very
cold.
short. I look pretty mask. I'm not even gonna lie.
It's not our first time getting confused as a couple.
No, it's not.
Hey, girl, hi.
Hey. So I'm just saying, I was not surprised when they came over and they were like, oh, girl, oh.
I don't even know if she knew you were a girl until maybe her husband finally told her, that was a girl. Oh, and the people next to us got all sketchy, too. Yeah.
Well, because we were sitting next to each other, too, because we were
talking.
I know, but it was funny. Yeah, people next to us, we're in coastal Texas, y'all. People next to us, moved tables. They thought we were cheating. It was a whole thing.
Yeah, it was a whole thing. Ooh, I love causing some controversy.
I just don't give a shit.
Nor did I. I'm like, bye. Don't steal our idea.
So, anyway, that is this week's episode.
Yay!
It's probably
what did you learn?
It's probably going to be a little over an hour. I've been trying to keep these at an hour, but this one it's kind of impossible. I'm going to whittle it down as close as I can. But yes, hopefully you learned some things. Hopefully you giggled. We are in all of our usual haunts. Yep. Oddly Medical all.
Everything Oddly Medical.
I have been averaging to get the YouTube video up by Friday.
Nailed it.
Pretty sure that's how we're going to go from now on. The podcast on Wednesday, the YouTube on Friday. I'm just going to set it like that because that seems to be what it takes me.
That works.
Let us know about t-shirts. What else?
That's about it. That's everything. Yeah, that's it.
Okay. All right. Well, thank you for joining us, our beautiful, intrepid oddlings.
Oddlings!
And as always, I'm Sarah.
I'm Chrissy.
And
bye!